Hello, everyone. My name is Noah. I am the communications coordinator for Voices for Vaccines. Today, I'm here with Dr. Jennifer Huang, who is a pediatric cardiologist, an associate professor at Oregon Health and Science University. She got her MD from the University of Kansas School of Medicine in 2007, did a residency at the Cincinnati Children's Hospital, and actually did 2 fellowships in pediatric cardiology, including one at Stanford, which happens to be where I did my undergraduate degree. I reached out to Dr. Huang because of her expertise in looking at the heart in a detailed way, and also her interest in this issue of COVID, vaccines, the heart. It's just very top of mind for a lot of people. So I wanted to ask you a few questions. I'll just ask the questions in order, and we'll kind of see where it goes from there. Does that sound good?
Sounds great. Thanks for having me.
So I wanted to start really basic. How do viruses impact the virus and then impact the heart, excuse me? And then on top of that, how does COVID compare to other viral infections in that way?
Yeah, so, myocarditis is inflammation of the heart muscle itself, and it's most commonly caused by viruses. So before COVID, it was caused by this class of viruses called enteroviruses or flu. There are many different viruses that can cause it. And we think that it's because of your body's response to the virus, that it's kind of a robust immune response where it actually starts attacking the heart muscle itself. And for some people, it's really mild and they never knew they even had it. For some people, it's much more severe. And for those folks, some of them can require being in the ICU and having lots of medications to support their heart. Some people require transplants, and other people can even die from it. So we've known about myocarditis for a long time, since the 1700s, I think. COVID particularly, so the COVID infection itself can also cause myocarditis. And we actually saw a huge bump in admissions for myocarditis in 2020 as compared to 2019. So even before the vaccines were out, there is like a 40% plus increase in admissions for myocarditis, most of which we think are from COVID. So, and in kids, it's a part of the multi-inflammatory response where, your body's kind of immune system is revved up and attacking its own organs.
Okay. And then I guess, so one other thing I'm wondering, you said a 40% increase. That's pretty unmistakable that something's going on there. But I guess I'm also just wondering, how does that compare to say other viral infections? So does flu do something like this?
Yeah, flu and other common viruses can, for some people, cause myocarditis. And myocarditis in general is most common in young, otherwise healthy people. So, and it's remained the case for COVID and for the post-vaccine myocarditis as well.
And so another question I have, so I think there's a lot of discussion about COVID and the heart. A lot of people kind of have pre-existing heart conditions, or, they're older and they're more susceptible to the virus. Kids tend to have healthier hearts just by virtue of age. They don't have, any kind of cardiovascular stuff going on yet, unless they have a heart condition. They also tend to be less affected by COVID. So can you speak to the health risks that there are, or the heart risks that there are for kids that remain?
Yeah, the great thing about kids is, like you said, they're overall healthy, and kids aren't supposed to die. So even though the complications with COVID for kids are rare, every kid that we admit with COVID complications is a huge deal, particularly if they have myocarditis from COVID or other organs that have been damaged, from their brain to their lungs and kidneys. And then the other things are, all of those other symptoms that don't result in hospital admissions, but certainly impact kids' lives. So long COVID, where kids just aren't able to do the things that they want. Kids should be able to play sports and keep up with their friends. And a lot of those kids that suffer from long COVID are not able to do that. They're feeling short of breath, they're feeling foggy and having those issues. And that's certainly not something we want for any kid.
No, absolutely. This is a question, I had a question later, but I think that might tie in well now. think long COVID is obviously still something we're learning a lot about, both in terms of what causes it and how common it is, and all sorts of things. Is that tied to the heart at all? I've seen speculation of what could cause that, but is that maybe even something that is considered an impact of the disease that has something to do with the heart or circulation or anything like that?
Yeah, we haven't found a tie-in with the heart. So we've screened these kids with echocardiograms or ultrasounds of their heart, and gotten labs for myocarditis. And most of those kids don't have any evidence of any heart problems that are causing it. We also don't know who's most, there's no way to know if a particular kid is going to get long COVID or not. But it is common enough that even, at OHSU, we have a specific clinic, a long COVID clinic for these kids now, just there's enough of them.
Wow. That's sad to hear, but that's, I guess, something that people do need to hear. I had no idea that was even a thing that was happening at different hospitals. So wow, that's really something. Okay, so the next question I did want to ask. So we talk a lot about rates of myocarditis, and that kind of implies something you detect, but there are some studies that say that COVID could cause subclinical heart problems, so subclinical myocarditis. There's one we talked about with Paul, which was, you might have seen, there's the Big Ten athlete
conference in the
United States, and a lot of these kids, I think it was 1 in 45 had some sort of myocarditis, symptomatic or not. I think most were asymptomatic, but a lot of them had that. So, could you comment on this risk? Is this something that really people should be concerned about? I mean, how do we even think about that?
Yeah, it's really hard to contextualize that. So that article was out of the Big Ten for those who haven't heard about that article, where they screened all of their athletes, so presumably young, healthy adolescents, and all of them who had COVID had a cardiac MRI to look for inflammation of the heart. And so, like you said, 1 out of 45 showed evidence of myocarditis on their MRI. Only 1/3 of them had symptoms of myocarditis, and 2/3 of them were asymptomatic, and we just found the inflammation on MRI. So it's hard to know. It's not like we've done many studies where we just screen the general population for signs of myocarditis. Well, there's definitely more people who've had myocarditis than we know of. So it's hard to say what the long-term implications are of that. I will say that sort of long term, there are people who have what are called dilated cardiomyopathies, so where their heart muscle fails over time. And we've postulated or thought that some of these people had myocarditis when they were younger, and that kind of predisposed them to the heart failure when they were older. So certainly that's a risk, although, probably those 2/3 that were asymptomatic will fully recover.
Right. Okay, it's reassuring. But obviously you want to avoid the disease.
Yeah, but it was striking how high that number was.
Yeah, no, absolutely. And I guess, what do those cardiac findings mean long term? It really is hard to tell. Could you, I guess, maybe there is nothing more to, we'll just kind of have to wait and see, but is that really a concern, or is it just kind of like an open-ended question?
It's not reassuring for sure, but like I said, it's hard to know if that will increase your risk for things like heart failure in the future or not. In the past, one of the concerns for myocarditis has been the risk for sudden cardiac death in young athletes.
Yeah.
So it is the number 5 cause of sudden cardiac death in young athletes. And so it's certainly a serious concern. And these are athletes. But those are people who are diagnosed based on clinical symptoms and chest pain and findings on echo, and not necessarily MRI, which is a much more kind of sensitive test. Hopefully, the ones that we just detected on MRI don't have an increased risk for sudden cardiac death.
Right. Gotcha. Another question, just to clarify this issue, what really is COVID myocarditis? So I know a lot of the cases do come from this condition, at least in kids, called MSC, which is an inflammatory condition. And I'm not sure the exact percentage, but a sizable percentage of those kids have myocarditis, and it's affected thousands of kids in the United States. I think it's like 7,500 kids in the United States. So it ends up being a lot of cases of myocarditis. And then there's also, I think, a differentiation between myocarditis, which is 2-3 weeks after COVID, and then COVID itself can cause myocarditis. So what are the differences between those conditions?
So, both of those are look the same on echo or MRI. If we took a biopsy of the heart or a sample of the heart, it would just show inflammation of the heart. So I'm not sure there's much of a difference in long-term risk but I will say that, the myocarditis that happens after the vaccine, we've shown and seen that it's really mild. So 98+% of the kids who've had myocarditis after the vaccine have had really mild cases. And, their symptoms typically go away in 1 to 3 days. So I think that there's a difference in severity. So the kids who have particularly the MISC, the MISC, are much sicker and do more poorly.
And then maybe just one more question, not to belabor this too much, but so I talked to somebody who had this, their kid had this vaccine myocarditis. Again, this is rare that she had a bad case. So I think her kid was hospitalized for 4 days, and I think this myocarditis resolves like 1 day most of the time, right? With ibuprofen. But I think the concern is that some kids have maybe a longer sequelae. I know, again, COVID has longer sequelae, but also kids recovering from this myocarditis might. So, I mean, do you see kids with this vaccine myocarditis? What does it look like when they actually leave the hospital, if you see them?
Yeah, I mean, like I said, most of them, their symptoms go away pretty quickly. And a lot of them just with, ibuprofen, which is a common anti-inflammatory medication. So, how long kids stay in the hospital, it kind of varies. And part of that may be that they're totally feeling better and fine, but we're keeping them in the hospital because their lab numbers aren't where we want them to be yet. We're looking for trends that their inflammation numbers are going down. And so there's a lot that kind of goes into how long they're in the hospital versus sort of taking care of these kids. They feel a lot better, a lot quicker than maybe their numbers.
Gotcha. Okay. That's a reassuring way to put it. This next question, so this is the one that Paul wanted to know because he brought up that Big Ten study. So he also wanted to ask, with the vaccine, could there possibly be some sort of subclinical thing going on? I mean, is that a possibility? And what would that even look like if it was?
Yeah, that is a good question. And it's certainly possible that there's a subclinical myocarditis with the vaccine too. We haven't done a study where we've MRI'd all kids who've had a vaccine or a large chunk of kids who had a vaccine or the COVID vaccine, the mRNA vaccine. So it's certainly possible, especially because, the point of the vaccine is to stimulate your immune system to respond to COVID. Yeah. And we know that myocarditis from COVID is caused from just too strong of an immune response to COVID. I certainly could see that you could have subclinical myocarditis with the vaccine too. We just don't know. I will say that, one thing is it's a very similar population. So the people who get myocarditis are typically young males from viruses, and the people who get post-vaccine myocarditis are typically young males as well. So there's some overlap. And there have also been some cases of kids, I don't know necessarily if they've been reported in the literature yet, but that have gotten both post-vaccine myocarditis and post-COVID myocarditis.
Wow.
There was something about those kids in particular that just predisposed them.
Gotcha. Okay. Wow, that's really unfortunate. I mean, that's hard for those kids. With the vaccine, it seems like it's causing less severe myocarditis. And so, I mean, with the subclinical, I mean, it's a possibility, but I guess then the assumption would still be, I mean, it's not going to be doing as much to your immune system as the virus. You probably still, your best bet's to vaccinate, I guess would be.
Yeah.
Okay.
Yeah, I think so. I think if you look at the numbers and, the point of the vaccine is to cause a little bit of a immune response just so your body remembers and knows for when it actually encounters COVID. Yeah. So, you could think if it's just providing a little bit of a response, the likelihood that it over responds is lower.
And actually, I think you might have answered this question, but I'll just ask it directly just to make sure that's not something to clear up there. This question was inspired. So I don't know if you know Tara C. Smith, who is an infectious disease PhD, who is based in Ohio, and she did an article on the long-term outcomes of COVID and the heart. And so I think there was a study in Nature, you probably have seen it not too long ago, that was saying that 1 year out, and it was the VA. So I think the VA is a very specific population, but they controlled for age, they controlled for gender, with small numbers, but still. And there was a year out, they were seeing that a bunch of different cardiac conditions had elevated risk, many different things that they were monitoring. So the question that a lot of people have, or some people have at least, is should we be concerned with long-term cardiac outcomes such as heart failure later in life post-COVID infection? Is that something to even really think about?
Yeah, I think, because we suspect that link between that type of heart failure, dilated cardiomyopathy, and myocarditis when you're younger, there's just so many kids, numbers wise, volume wise, who've gotten COVID infections. And if you kind of extrapolate from that Big 10 study, there's just going to be so many kids who have myocarditis or, clinically or subclinically. And what's their risk going to be 50, 60 years down the line? Because they're young now, they may not have any problems now, but the question is, are we going to see, long-term, years down the line, an increased number of people who have heart failure?
And is that something that happens with, again, like say flu, for example? Can a virus that is earlier in your life really do that? Does that happen with these other kind of things that we deal with commonly?
Yeah, that's what a lot of people have hypothesized. We don't know exactly. It's not like we've followed kids who've had the flu into their 50s or 60s. But if you look at samples of their heart, there's some signs that they've had potentially myocarditis in the past.
Just to read the quote actually from Tara, she kind of maybe put it the same way, where she said that, that there's this increase, it's a rare increase in the severe outcomes, but what it indicates is a concerning pattern that it's doing something to the heart, which seems to be a good way of putting it. And then the last formal question, so I maybe some other quotes that I would like to go through, but this one that I think is also on people's mind is COVID is a very new disease. I mean, one of the main things that drove this rampant infection was that nobody had any immunity. And I think that was what people hypothesized led to long COVID in part, just because it happens with other diseases, but this one it seemed to be happening a lot because it's so novel. So the question to ask then is, are these heart risks going to matter in the future once we start to build up immunity to COVID through infection, reinfection, vaccination, whatever? Is that something to think about long term, or is this kind of a one-time thing that we need to be concerned about?
This coronavirus is something that probably is never going to go away. And as we've seen, it keeps on mutating. So it's hard to know what these new mutations will look like. I will say it's concerning to me that, Omicron particularly mutated so that it affected a lot more kids. I think we don't know what the long-term effects are. We're still only 2 years past the initial infections, but knowing how many organs have been involved and all of the sort of neurologic, cardiac sequelae and things, I think it is something that deserves our attention. And I think that's the reason why so many health professionals are so avidly pushing for vaccination, because we want people to have some immunity. And it seems that, immunity from vaccine probably has less risk for long-term sequelae than immunity from the infection itself.
And then I will ask, I'm going to read a quote. So I do like to elaborate risks so people are educated, and the prescription is to vaccinate, but I also just want to make sure that we contextualize risks. So the quote is, given the large and growing number of people with COVID-19, the risks and 12-month burdens of cardiovascular diseases reported here might translate into a large number of potentially affected people around the world. Governments and health systems should be prepared to deal with the likely significant contribution of the pandemic to a rise in the burden of cardiovascular diseases. Because of the chronic nature of these conditions, they will likely have long-lasting consequences for patients and health systems, and also have broad implications on economic productivity and life expectancy. So my question is, I think a lot of people hear this and think that the virus is generating, heart disease left and right. I mean, how do we take this seriously, but kind of how do we put this risk in context?
Yeah, I mean, I think it goes back to that research that you talked about in the VA. You're already seeing some increased numbers of heart conditions in a population. The VA population. The great thing about studying that population is they're kind of a captive audience, and all their healthcare is in one system, so you're not missing much. And to see that they've got an increased amount of cardiovascular disease, heart conditions, you can just extrapolate that to the rest of the population. We already know that cardiovascular disease is the number one, disease that causes people to be sick, lose work abilities, and that leads to death. And so to have something that's so big that affects so many people, which is COVID infection, potentially increase that, even if it increased it only by a tiny percentage, you're talking about billions of people.
Okay. And then in terms of heart health for children, what would be something that you think you're concerned about, you think would be good for parents to know? I mean, what would you like parents to know at this point in time for their kids' heart health?
I think as parents, we try to make the best decisions for our kids. Luckily, heart problems in kids are more rare. But what can we do to prevent things? Well, as far as myocarditis goes, the vaccine. I have a 6 and a 4-year-old. I got my 6-year-old vaccinated as soon as it was available, anxiously waiting to vaccinate my 4-year-old, because these are the things that I can do, the choices that I can make to try to decrease their risk of heart disease as much as I, knowing the literature, knowing what I do know, those are the things that I think can prevent them from having heart disease in the future, or as much as I can change the risk.
Okay, great. I think that is everything that I had wanted to ask, and from sourcing from different people, I think they had wanted to ask. It's good to get, I think, a very in-depth perspective on this issue, just because it again, I live with a heart condition. I've been to the hospital actually over the pandemic, so it's a very scary time to be living with a heart condition. And
yeah,
it's something that even when you don't really understand. I mean, it just sounds so scary to people.
Right.
To have a potentially a risk that sudden cardiac death. I mean, that's a really, really scary thing, and they actually are more common than we think. But the ultimate advice there is to make sure that you reduce the risk, and there's a clear way to reduce the risk so much. With COVID. So
right.
Good to know the risks, and good to know obviously the one thing, one of the main things that you can do about it. So awesome. All right, thank you so much for this. This has been wonderful, and I think this will inform a ton of people. So thank you so much for doing this.